When I teach physicians or surgeons about the FUE techniques, the question that I always get is, which device should I use? There are many devices out there, basically they do the same thing. I compare it to using a Bosch drill or a Makita drill. They both do the same thing, it's just whatever you're more comfortable with. So that's what I tell the patients that I'm training. If they can use every machine and kind of compare the goods and bads of every one of them, they will come to select the best that fits their style. One machine that's marketed real heavy, it's called Neograft, to the point where now patients sometimes confuse that with the actual procedure. They'll come to me and say, well, I want to have the Neograft surgery. Neograft is a tool like the one I use, it's called the Alphagraft. It's just a tool to harvest the hairs. It's actually totally operator dependent. Whatever your doctor is doing, who is operating that machine, if they don't know what they're doing, the machine is not going to do the work for them. Even the robot doesn't do that, the Artas, which is the latest technology. It's robotic assisted, but you still have to be there, the physician. So it's actually an extension of the doctor and not a substitution for him. FUE procedures can be done with any other equipment that you want, as long as your doctor or the physician that's doing it is very proficient and accustomed to it. The reason why I chose the Alphagraft is because even though I'm a big guy, I like to deal with small things, and that has no cables, it has no paddles, it's a handheld device, fits really comfortable in my hands, and to me allows me the flexibility that I like to perform the best. The important thing is when the grafts come out of the scalp, that they're intact and protected no matter how you do it.